Human metapneumovirus or hmpv is a significant respiratory pathogen that has been increasingly reported in China. This virus, first identified in 2001, belongs to the Paramyxoviridae family, which also includes other well-known respiratory viruses such as respiratory syncytial virus, RSV, and parainfluenza viruses. Over the past 2 decades, hmpv has emerged as a major cause of respiratory infections worldwide, with a particularly notable impact in densely populated regions like China. This virus can cause severe respiratory illness, particularly in young children, the elderly, and those with weakened immune systems. Symptoms of hmpv infection can range from mild cold-like symptoms to severe respiratory distress, which may require hospitalization. Common symptoms include fever, cough, nasal congestion, and shortness of breath. In severe cases, patients may develop pneumonia or bronchiolitis, which can be life-threatening, especially for vulnerable populations. In this video, we will explore the impact of hmpv in China, a country with a vast and diverse population, where the healthcare system faces unique challenges in managing and controlling the spread of infectious diseases. We will delve into the epidemiology of hmpv in China, examining how the virus spreads within communities and the factors that contribute to its transmission, its symptoms, transmission, and the measures being taken to control its spread. Understanding the transmission dynamics of hmpv is crucial for implementing effective public health interventions. The virus is primarily spread through respiratory droplets when an infected person coughs or sneezes. It can also be transmitted by touching surfaces contaminated with the virus and then touching the face, particularly the nose, mouth, or eyes, and the measures being taken to control its spread. In response to the increasing incidence of hmpv infections, Chinese health authorities have implemented a range of measures to mitigate the impact of the virus. These measures include public health campaigns to raise awareness about the importance of hygiene practices, such as regular hand washing and the use of masks, especially in crowded places. Additionally, efforts are being made to improve the diagnosis and treatment of hmpv infections in healthcare settings, with a focus on protecting high-risk groups such as young children and the elderly. Researchers in China and around the world are also working tirelessly to better understand hmpv and develop effective vaccines and antiviral treatments. While there is currently no specific vaccine for hmpv, ongoing research aims to fill this gap and provide additional tools to combat the virus. In the meantime, supportive care remains the mainstay of treatment for those infected, with healthcare providers focusing on alleviating symptoms and preventing complications. Public education and community engagement are also critical components of the response to hmpv. By informing the public about the risks associated with the virus and the steps they can take to protect themselves and others, health authorities aim to reduce the spread of hmpv and minimize its impact on society. Community health workers play a vital role in this effort, reaching out to individuals and families to provide information and support. International collaboration is another key aspect of the fight against hmpv. Scientists and public health experts from different countries are sharing data, research findings, and best practices to enhance the global response to the virus. This collaborative approach not only helps to accelerate the development of new treatments and preventive measures, but also strengthens the overall capacity to manage and control respiratory infections on a global scale. As we continue to navigate the challenges posed by hmpv, it is essential to remain vigilant and proactive in our efforts to protect public health. By staying informed, practicing good hygiene, and supporting ongoing research and public health initiatives, we can work together to reduce the burden of hmpv and safeguard the health and well-being of communities in China and around the world.